Good morning and welcome back to Radiant Rise. It's Sunday morning, the house is quiet, and everyone is still settling into their morning. And I finally have a little bit of peaceful time to sit here and talk. My surgery was Tuesday, so as I record this, it's only been 5 days. 5 days since I walked into the hospital, scared, overwhelmed, but hopeful that surgery might finally give us some answers after everything I've been dealing with. And 5 days later, I'm sitting here at home trying to process everything that happened. I'm still sore. I'm still exhausted. My body is reminding me very quickly when I've tried to do too much. And honestly, I don't think I've emotionally processed all of it yet because I went into that hospital thinking surgery was going to be the hard part. I had mentally prepared myself for pain. I prepared myself for incisions. I prepared myself for needing help afterward. I prepared myself for the possibility that I could wake up and find out that they had needed to remove my ovary or my appendix. What I didn't prepare myself was for my oxygen dropping while I was still under anesthesia. I didn't prepare myself for breathing treatments during surgery. I didn't prepare myself for waking up and continuing to have trouble breathing. I didn't prepare myself for oxygen, and I definitely didn't prepare myself to hear we're admitting you to the hospital. So this isn't an episode where I'm looking back months later and telling you everything I learned from this experience. I'm still living it, and there are still questions I don't have answers to. I haven't even had my post-op appointment yet. There are things about the surgery that I'm intentionally not going to discuss today because I want to sit down with my surgeon, ask my questions, understand everything myself, and then share what I'm comfortable sharing. But I can tell you what these last 5 days have been like, and that's what we're going to talk about today. This particular chapter of my health journey really began back in September. That's when the pain and symptoms started that eventually led me here. Since then, it has felt like my life has become this revolving door of pain, bleeding, GI symptoms, doctors, testing, emergency rooms, hospital admissions, procedures, medications, waiting, and questions. So many questions. There have been many moments when I've just wanted someone to tell me, this is what's happening, this is why you're hurting, and this is what we're going to do about it. But health doesn't always work like that. Sometimes you do the test and you don't get the answer. Sometimes you see another specialist. Sometimes one symptom improves and another gets worse. Sometimes you end up back in the hospital, and living in that uncertainty is exhausting in a way that's difficult to explain unless you've experienced it. Because chronic health problems don't stay neatly contained inside your body, they spill into everything: work, finances, relationships, plans, sleep, your independence, your mental health, even your ability to plan something as simple as what you're going to do next weekend. Eventually, surgery became our next step. And then suddenly, I learned I had 2 weeks to prepare. 2 weeks sounds like enough time until you're trying to prepare your entire life for surgery while you're already sick and exhausted. Sudden, Suddenly, my brain had a million things running through it. I needed to prepare my house, clean, do laundry, get recovery supplies, set up my recovery cart, figure out what I needed after surgery, prepare things for work, make sure everything was organized, figure out who would help me, prepare for the coming home and surgery day, but also prepare for the possibility that I might not. And then there were things you can't prepare for with a shopping list. What are they going to find? How much pain am I going to be in? How long will recovery take? What if there's bowel involvement? What if they do need to remove my appendix? What if I wake up without an ovary? I remember feeling like there was so much I needed to buy, so much I needed to do, and so much I needed to prepare. And I didn't have enough money, energy, or time to do all of it. That added an entirely different level of anxiety. Eventually, I had to accept that I wasn't going to walk into surgery feeling perfectly prepared. I was just going to have to walk in. And Tuesday came, whether I was prepared or not. Surgery morning was emotional. I was scared, anxious, overwhelmed. But underneath all of that, I was hopeful. After months of living like this, I wanted answers. One of my biggest fears was waking up and learning they had to remove my ovary and appendix. Thankfully, they didn't have to remove either one. I'm incredibly grateful for that. They did remove areas that appeared suspicious for endometriosis, along with scar tissue and adhesions, and that's as far as I'm going to go with the surgical findings today. There are things I still need my surgeon to explain to me. I have my post-op appointment coming up, and I want to hear directly from her about what she saw, what she did, and what everything means before I interpret any of it publicly. There's something this entire medical journey has taught me. Sometimes you have to be comfortable saying, I don't know yet. But while all of that was happening surgically, something else happened that I wouldn't learn about until afterwards. My oxygen and breathing started becoming a problem during surgery. I have asthma, and while I was under anesthesia, they started having difficulty with my oxygen and breathing. The team had to make adjustments during the procedure and give me breathing treatments. There's something unsettling about learning afterward that your body was struggling while you were completely unconscious, because anesthesia requires an incredible amount of trust. You close your eyes, and for however long you're asleep, your body is completely in someone else's hands. You trust those people to notice when something changes, to react, to protect you, and that's exactly what they did. But when surgery ended, the breathing problem didn't. After surgery, my oxygen continued to be low. I was struggling to breathe. I needed supplemental oxygen. I continued needing treatment for my asthma, and I developed postoperative hypoxia. Instead of recovering for a few hours and then going home like I expected, I was admitted to the hospital. That was probably one of the hardest moments emotionally, because I had prepared myself for so many possible complications, but somehow breathing wasn't the one I had been afraid of. Suddenly, the biggest concern wasn't my incisions, it wasn't even my pain. It was whether my oxygen would stay where it needed to be. At one point, they wouldn't even allow me to get out of bed without someone helping me. They were concerned that my oxygen could drop, I could become dizzy, and I could fall. Think about that for a second. I had walked into that hospital on my own, and now I couldn't even stand beside my hospital bed without somebody there. That loss of independence, even temporarily, hit me emotionally. I felt weak, I felt vulnerable, and yes, I was scared. Eventually, they did a chest x-ray and learned that I had atelectasis. I'm not sure if that's how you pronounce it. In simple terms, small areas of my lungs weren't fully expanding. So now my body wasn't only trying to recover from surgery and anesthesia, my lungs were struggling too. Between the atelectasis and my asthma, breathing became the focus. Oxygen, breathing treatments, using the incentive spirometer, trying to move when it was safe, monitoring my oxygen, and waiting. It's amazing how quickly your priorities can change. Before surgery, my mind was consumed with what they would find inside my pelvis. After surgery, I just wanted my lungs to cooperate. I wanted to breathe well enough to go home. Eventually, my doctor came in and told me something that gave me both relief and frustration at the same time. From a surgical standpoint, I was okay. That was wonderful news. But they still couldn't discharge me. My asthma and oxygen weren't where they needed to be. So even though surgery itself wasn't keeping me there, I still couldn't go home. Later, a nurse came in and told me they were moving me to a regular hospital room because I was no longer considered critical. That sentence meant so much to me. You're no longer considered critical. Okay, we're moving forward. We're getting somewhere. My body is responding. Eventually, I was able to maintain safe oxygen levels without supplemental oxygen. And finally, I got to go home. There is something about walking back into your own home after an unexpected hospital stay. Everything feels different. Your bed feels better. Your couch feels better. Your shower, your pillows, even silence feels different. I was just grateful to be home. But coming home didn't mean suddenly feeling okay. It's Sunday morning as I'm recording this. I'm 5 days out from surgery. I'm still sore. I'm still exhausted. Simple things take energy. My body has been through surgery, anesthesia, breathing complications, hypoxia, asthma problems, atelectasis, oxygen, and an unexpected hospital admission, all within the last 5 days. That's something I have to keep reminding myself because there's a part of my brain that already wants to get up and start doing things. Clean something, work on something, be productive, get back to normal. And then my body very quickly says, absolutely not. So I'm learning to listen. Right now, my job isn't productivity. My job is recovery, rest, breathe, heal. One thing I want to make really clear is that surgery hasn't magically answered every question. I haven't had my post-op appointment yet. There are surgery findings I need explained. There are questions I need to ask. And there are things I'm deliberately choosing not to share publicly until I understand them myself. That's not me hiding something. That's me recognizing that I don't have enough information yet. And I think there's something important about saying that openly. We live in a world where we feel like we have to immediately have an explanation for everything. Sometimes the reasonable answer is, I don't know yet. I'll know more after my post-op appointment. And when I'm ready, I'll share that next part of my journey too. I've received so many messages this week. People praying for me, checking on me, calling, sending gifts, offering help, asking for updates, and I haven't had the energy to respond individually to everyone. But one message I received really stayed with me. It reminded me why I continue telling my story. Sometimes I wonder if I'm sharing too much. Maybe I should wait until I'm completely better. Maybe I should only tell the story once there's a nice ending attached to it. But that's not real life. Sometimes we're telling the story while we're still living it. That's what I'm doing this morning. I don't have the endings. I don't have all the answers. I'm literally sitting here 5 days after surgery, trying to process what happened. But maybe somebody listening doesn't need me to have a happy ending. Maybe they just need to know somebody understands what it's like to be scared, to be exhausted, to live with chronic pain, to go through test after test, to prepare for surgery, to have something unexpected happen. to come home and realize recovery isn't happening as quickly as you'd like. Maybe somebody listening just needs to hear you're not the only one. And that's one of the biggest reasons Radiant Rise exists. Not because I have everything figured out, definitely not because my life is perfect, but because I know how lonely difficult seasons can feel. If telling the truth about mine makes somebody else feel a little less alone in theirs, then sharing is worth it. So here I am, Sunday morning, 5 days after surgery, sitting quietly at home, recording this while my body is still healing. I don't have a perfect inspirational ending for this episode. I think forcing one would actually take away from what I'm trying to say. I still hurt. I'm tired. I still have questions. I haven't had my post-op appointment. I don't know exactly what the next chapter of this medical journey is, but I do know this. I'm home. I'm breathing on my own. I'm healing. Five, 5 days ago, I walked into a hospital not knowing what was going to happen. Today, I'm sitting here talking to you, and right now, that's enough. If you're listening to this while you're somewhere in the middle of your own difficult chapter, please remember, you don't need to know how the story ends to keep going. Sometimes getting through today is enough. Sometimes getting home is enough. Sometimes taking the next breath is enough. Thank you for everyone who has prayed for me, checked on me, sent messages, called, sent gifts, helped my family, or simply thought about me this week. I may not have the energy to respond to everyone, but I have felt so much love. And thank you for allowing me to share the unfinished parts of my story. I'll talk more about my surgery and what comes next after my post-op appointment when I have the information and answers I need. But for this Sunday morning, I'm going to close my laptop, put my microphone away, get comfortable, and do the three things my body needs most from me right now: rest, breathe, heal, one day at a time. I'll talk to you again soon.